Good morning, everyone. A very warm welcome to all of you joining us today for this webinar session. I am truly delighted to have the honor of introducing our distinguished guest speaker, Dr. Divya ma'am. Uh, she is graduated in 2011 from the Government Homeopathic Medical College, Madurai, Tamil Nadu, practicing in the last 13 years at Traiki, Tamil Nadu, in the name of Hygeia Homeopathic Clinic. She is blessed to learn from Dr. Shekhar Algundgi sir and Dr. Mahesh Gandhi sir. She is teacher and core committee member of Swara Homeo Gurukul. She is organizes national homeopathic seminars. Her lectures at various colleges and seminars at national level has inspired many students and doctors to learn the best in homeopathy and practice it. Owing to her skill of empathizing with the patient and compassionately being with them. She is helping hand for all the patients. She is well versed in understanding the psyche of patients and changing the total perception of them through homeopathic medicine. In previous session, Dr. Divya ma'am discussed about understanding the materia medica of umbellifera family remedies and the differentiation with the Longinaceae family. Today, ma'am discuss about art of case taking in pediatric cases. So without further delay, I invite you all to join me in extending warm welcome to Dr. Divya Radhakrishnan, ma'am. Thank you. Welcome, ma'am.
A very good morning to one and all present here. So today we are in day 14. Hope you are learning many new things every day. Am I audible?
Yes, ma'am.
Okay. So today we are going to have an interesting learning about pediatric case taking. Who don't like children? Everybody like children. So there is some artistic way in dealing with children so that you can explore the deepest core of them. Because if children don't adapt to with you, they don't open up, they don't talk, they just cry, they just leave the consultancy room, and so it will be difficult to gather symptoms or connect with them. So by knowing some skills which is basic and which we all know, but when it comes to consultancy room, we become as a doctor and we try to converse with children as adults, and that's the problem where most of the children don't connect with us. So we'll be seeing a few clinical practical skills, simple skills, which will be helping us a lot to connect with children. So pediatric age group is from birth till 18 years. What is the first most essential thing, which is the attitude of the physician in child case? So that is, we have to be super sharp and alert and observe everything, because in a blink of eye, child does something that is peculiar and we doesn't notice it. We can't be blunt and we can't be slow while taking a child case. You know, like children are so much full of energy. They are quickly changing from place to place, or desiring many things, or they don't sit in a place. So our senses should be super sharp and alert. That is the first thing in a child case. And a physician should be soft, gentle, friendly, and caring, with genuine interest and love for children. And this, nobody need not teach us. If a child comes to our home, or when we converse with a child in our relations, how we converse with them, we become a child. Our voice tone changes, our gesture changes, we smile at them. We don't rudely handle a child, right? So the words also changes. It becomes like a pampering type of words. So same way you have to be in the consultancy room also. You have to be smiling and polite, even though the child is cranky, crying, and they are at their worst, then also you have to be smiling and polite. And if you begin to shout at them if they are at their worst, then you have lost the connection forever. So you have to be with a smiling face, treat them as a child and not as a patient, so that it gives a comfort to the child. In recent days also, like in social medias, you will be seeing some videos where the doctor, when they are giving injection to the child infancy, they just play with the child. So the child laughs, and in that moment they pierce that injection, and the child even doesn't know that the injection is getting pierced. So like that, you would have seen many videos in social media. That is the way of dealing with the child. So ultimately, the body language should come down, both physically and mentally. Both physically and mentally, the body language should come to the level of the child. So the consultancy room should be well lighted. This is in general, it should be quiet. So for us, it is always like that, because we are going into deeper connections with patients. So it's always better to keep the consultancy room well lighted, quiet. So for children to feel that atmosphere, we can keep some gift toys for them. So they get that bonding with the doctor. You can get small chocolates or pencils, rubber, stationery things, or small toys which is of less rates. You can get it and keep at your clinic, and you can give that to the child at the beginning to create that bond between the child and the doctor, or even in the middle when you encourage the person, child, to talk. If you tell this, then I will give you a gift. Sir, there'll be a surprise gift for you. And then by the end of the session also you can give. Both ways it will be helpful, either in the beginning to create that bond, or to make them talk during case taking. The most important thing is, don't stare at the child into the eyes. Then that causes a fear into them. So this is the basic attitude of the doctor, which should be smiling, friendly, caring, create that connection with the child. So pediatric cases is little longer than adult cases, because in adult cases, we just converse with the patient. But here it is like three-way conversation. First is the history that is narrated by the parents about the child. Second is the personal interaction with the child, that what we are talking with the child and the observations that we are doing about the child. And the third one is pregnancy history, prenatal history. And this pregnancy history is not needed in a child like about 11 years or 12 years. Whosoever is talking well, we are able to get the deepest core of the child, and what is the cause of the disease. If we are able to find it, this pregnancy history is not needed, but this is essential to the most in congenital disease, pathological disease, or some chronic disease that is there since birth. It is repeated. Even it can be a simple common cold also, but the child is getting cold every 15 days once or weekly once for the past 7 years, then pregnancy history is the must. So these are the three things which we have to take in pediatric cases, and we will see one by one how to gather it in an unprejudiced way. So the first thing is history narrated by the parents. It is always better to speak with the parents first rather than the children. What happens, I have experienced this 2-3 times at my clinic also. When you directly speak with children, and especially of adolescent age group, or like or about 10 years also, 9 or 10 years. And if the consultancy time takes little long, 30 minutes or even 1 hour, most of the parents are not accustomed to this type of consultancy. So they get that anxiety when they are outside. What happened to my child? Why it is taking so much time? So it is better to first narrate the parents that I will be speaking with your child alone, and it might take little long also depending upon the how the child is responding. Don't worry about it. So like this, telling the parents will help. And first, if you speak with parents, they feel that I have told everything about my child to the doctor. And so now doctor will take care of the child. It is like gaining their confidence. So always it is better to speak with parents first. So while speaking with parents, certain things like they will, if the parent is over anxious, then they will be asking too many questions. So that time we have to give them a proper explanation regarding the child, regarding whatever question is asked, or regarding the disease. So it brings their anxiety level down. And so our journey like of case taking with the child becomes more easy. So always, if both the parents has come, then better to speak with both the parents together. If only single parent has come with the child, then okay, to that parent you can speak. But when it is both parents, speak with both of them together. The reason is, see, some informations given by one of the parent will be missed by the other parent. So in order to gather informations more, so that nothing is missed out about the child. One. Second is, sometimes the parent tell about the child through their perception. So what happens? Mother tells the child from her perception, then father rectifies it. That also happens. And sometimes when mother is telling something about the child, and if father tells yes, yes, then it is like a double stamp. Okay, this is something that needs to be taken because both has confirmed it. So in all these aspects, having both the parent together in the consultancy room helps. But if there is dispute between the parents, mother and father, and if there is no synchronization, if they are both are always in conflict during their talk, it is better to speak with parents alone. First speak with mother, then speak with father, and see what is the commonality in both of their talks. Because that is which is inclined towards the child. Rest other things are from their own perception, which is from their own fears and emotions. So if the child is small, you can very small like infant till 4, 5, 6 years also, the mostly the child also will be with parent. So during that time, you observe the child's behavior. Constantly, it has to be observed during interview. The way the child sits or what the child is doing, what is the child interested about. And sometimes you can see this also. When the parents are telling something, the child face expression changes. That it shows anger or it shows smiling or something. The expression changes, the gesture changes. So make a note of all those things, what the parent is telling and what the child is responding. So this is why I was telling in the beginning, you have to be double alert. You have to be so your senses has to be super alert in child cases because it is two-way. Now you have to speak with the parents, listen what they are telling, and simultaneously observe the child, what the child is doing. So when we keep a paper, color pencils on the table, sometimes what happens, the child voluntarily takes that paper and begins to draw. And there is some connection between whatever the parents are telling and the drawing. So that also helps. So it is not always that there should be a connection. Sometimes it can be they are drawing just a tree, house, like that also. So in two ways it helps, either to get the abstract things or the child remains quiet drawing something. So When the parents are in their full flow, don't try to ask any questions because it might interrupt their flow of thoughts, and it might also superimpose our diagnosis towards the child, about the child. So better to remain quiet when the parents are in their full flow. Try to speak out. And if the child is resentful of their parents, then better to get the information in a privacy. So the child will be happy to share their thoughts. This is especially in adolescent children. Younger children, they will not be mindful of these things, but generally adolescent children from age of 12, even now it is so soon because of this technology, uh, children begin to repel parents even from the age of 11 years. So if you come to know from their way of telling that there is no proper connection between parents and child, then better to speak with child alone. Don't keep parents in the consultancy room. Tell the parents about what you are going to do with the child. So when such type of cases, even speaking with parents alone is good. Keep the child out. I will speak with you alone. Let the child be out. Speak with parents also in privacy and then call the child. And if that happens in these type of children who are repelling their parents, who are against their parents, then when the child first enters the cabin, first thing is you have to win the confidence of that child by telling the parents are just joking. I will believe only you. Whatever you are telling is only truth. I don't believe your parents. So these type of words make the child to get connected with the doctor. Okay, doctor is supporting only me. She is or he is not supporting parents. So they will be talking with us. That is the intention of it. So if it is a young child, small child, the observation that is done by the parents and by the physician are of utmost importance. Both plays a vital role. So in those type of children, you can tell the parents what a difference you see in your child. Whatever you want to tell about your child, you can tell, because generally parents tell all the physical complaints. They don't tell about the emotions of the child or the fears or the nature of the child. They don't tell generally about. If something is negative, then they tell, like the child is so much angry, violent, hits the parents or other children or something negative, then they tell. But positive things they don't tell. So always try to encourage the parents to tell the positive things about the child also. What difference you see in your child compared to all other children, please tell everything, both the negatives and positives. So it will be helping for us to find the polarities. So in this, if a child is acutely ill, and if the child comes with fever or tonsillitis, and which is of acute 2 days, 3 days, then all these data collection of bigger things are not needed. Just have a brief suffice to identify the primary problem of concerns. From when did this complaint begin? What was the cause of the complaint? What are the changes in the child since this complaint? Changes both in general, like appetite, thirst, sleep, and at mental level also. In the behavior of the child, in the attitude of the child. So you ask the parents what are the changes you are seeing both physically and mentally since the beginning of this complaint. For example, cold is there since 3 days. Since 3 days, what all the changes you are seeing in the child? So a brief collection of history will be helping in acute cases. So now we saw what should be the attitude of the physician. and how the history has to be gathered from the parents. Is there any doubt till this, or shall we go forward? Is it clear till here? Please type your messages in chat box. Only Janaki has replied. What about others? Is it clear till here? Okay. So now we are going to take the second part, which is we are going to converse with the child. Now, how that conversation should be. So, questioning of the children should be avoided at the very beginning of the interview. Now the child has just entered the cabin. Don't shoot with your questions, like how we are asking to adults, tell me all your problems, all those things. Or if you have interacted with the child outside the cabin in the waiting room area, then you can start. But the first thing is, don't start your questioning like the child is a patient and now you are a doctor. That type of thing should not begin immediately. So never start examining the child as soon as he or she enters the clinic. First, build a rapport with the child before examination. So how this rapport can be built? If it is a school going children, then you can ask their name, which standard they are studying, they are from which school. You can ask about their friends, about their teacher. So something you can converse in general so that the child is at ease. And if it is a small child, then you can ask, what is your name? What did you eat morning? From where are you coming? How did you come here from your place? Or something like that. Can we be friends? Will you include me to play? Like that, something that is common which we converse when we meet our relative children. Like that, you have to talk first. So the most essential things that has to be taken care of is don't ridicule a child. Don't laugh. Laugh in the sense you can smile, have a pleasant smile, but don't laugh when the child is telling something seriously. And it should not be always like a funny and amusing thing. And don't tease the child. Unless otherwise the child is very well known to you, don't tease the child. So observation has to be in each and every moment the child should be noted properly. And the maximum time has to be spent on observation rather than questioning and gathering information, because the child is full of energy and they wish to do what they want to do. Most of the time the child doesn't even sit properly on chair. They put legs on chair, they go here, they go there, they take something on the table, they go outside also, open the door and go and meet their parents and come. Many things they do they because they are full of energy. So careful observation always reveals the stress and concern which otherwise are not apparently known. And sometimes playing these tricks help to gain the confidence of the child. So, like neglecting the child and proper respect to the mother gain the child's confidence, because it's always like if you are trying to give too much attention towards the child, then the child will repel. It's always opposite. Too much care, too much attention, it repels. So always, like Shekhar sir also tells, detachment is the best form of attachment. So detach yourself from the child and give proper amount of respect, seriousness, concern about the child towards the mother while it is conversed. So by this, what happens? The child gains the confidence to speak with you later. So sometimes we have to confirm the observations by direct questioning, sometimes by leading questions, and sometimes by tricky questions. Direct questions which we know, like changes specifically, also you can ask what is the change in thirst or whatever it is. Direct questions which we all know. Sometimes it is like leading questions also. How is the milestones of the child and so and so. And some it is tricky questions. This is the best part in pediatric case taking. See, unless otherwise you play a trick, the child will not open up. So, like if they are not telling their dreams, okay, then you can tell, okay, your mother told me that you are getting a dream which you told her last week, but you're not telling me. Like that, if you tell no, even though if mother did not tell also, when you play this trick, the child opens up. Yes, yes, doctor, I told that day a dream to my mother and I will tell to you. So like this, or Shekhar sir has taught us few tricks like giving marks to the child. Like now, if you tell this, I will give you 25 marks. Last week, your friend came for consultation and he got 25 out of 25. So let us see now how much you are getting. So whenever the child replies, keep marking. You got now 5 marks, 20 more marks is there. So like this, playing tricks. Or if you tell, then I will give you a surprise gift. So like this. So these type of things. And another thing, like supporting their friends who are their enemies. If you come to know, if the child is not in pally with a friend or there is a fight with friend, then supporting that friend. Okay, Suresh is a good boy. What bad is there? What he did wrong? He is a good boy. He has to do like that only. When you support, here the anger of the child or whatever violence or whatever the state that is there inside instigated gets instigated and comes out. So playing these type of tricks also helps us to make the child to speak which is inside. So the basic thing is the child should be contented. So they sits, and otherwise many times what happens, the child tells no, here on I'm not going to speak, and they just leave the consultancy room. You'll be left nowhere. Like you can't even make them to open the mouth and talk. So they will just, sometimes it has to be like this type of trick. Sometimes it has to be encouraging. So it's a combination of many roles when it is a pediatric case. And once the child has decided, and now I'm not going to talk, you can never open their mouth from there on. So always we have to remember these things. In child case, the consultation has to be quick because the child, we know they can't sit in a place for long time. So they lose that patience. So better to finish the consultation quick instead of dragging and pulling, gather the information quickly. And in very small children, frequently encouraging them. Yeah, you're doing very good. Call out their names frequently during the consultancy. They feel more connected when you call their names. Yeah, Priya, you are a good girl. So you are doing very well. You are speaking very well. Keep on encouraging them. Even now, if we have to see, if you have child at home or your relatives' children, generally they like to be appreciated. They wear a dress and come and they show that to others to get that appreciation. They stand in front of the mirror seeing it. So all those, because that is the time of developing of identity. So frequently encourage them during the case taking process. Good, very good, and give high five. So all these things help. By all these means, in case if they are losing the interest to talk, then better to ask about their likings, what they like and their hobbies. So they get that interest to talk. So at the end of all completing all the case, and if there is problem between the adjustments of the child or its behavior, or there is anything in the family like the dispute between the parents that is affecting the child or whatever it is, better to give suggestions separately to the child and to the parents, or sometimes together with everybody. It all depends upon the situation. In the moment of time, you have to decide it depending upon the suggestions that has to be given. So in child case, there cannot be a fixed and regular pattern of history taking, as the questions will change depending upon the age of the group of the patient we are dealing with. If it is 3 years old, it is different. 7 years old, it is different. 14 years old, it is different. Or some children are introvert or some children are extrovert. So it all depends. But these are the basic data if we gather, that will be helpful for us during analysis. The chief complaints, the history of the present complaints, like when did it began, other symptoms that is associated with that complaints, past history, like whether the child has got these symptoms previously, or what other physical symptoms or emotional disturbance, whatever it is, or whatever you have gone to the doctor previously. What are the complaints that the child get repeatedly? So all these things, gathering these things will help us to see a connectivity. So the prenatal history, pregnancy history, which is the most essential in congenital, pathological and chronic disease. So this pregnancy history includes the stress, the fear of the mother during pregnancy. You have to tell the mother clearly whatever you are going to tell is only from the day you saw that the pregnancy is positive until the delivery of the child. I don't want anything before that or after that. Whatever you are going to tell is only during these 10 months. So if it is in recent, then they remember it quickly, or if it is from distant past, then there is 2 3 children after that baby, then the chances of mother to forget. So in that cases, first speak with the parents about the child. Tell the parents, now I'm going to speak with the child alone, so you can speak with the child. And during that time, tell the mother to sit outside of your cabin and meditate upon that 10 months. Bring that 10 months in front of your eyes. Just picturize the whole scenario and see what all has happened. So, what happens when you are consulting the child in your cabin and the mother is meditating upon the same thing outside? There is an aura that is connected. So, whatever the child talks, the mother also experiences, or whatever the mother experiences, the child also talks, which is completely abstract. So, this things you have to tell during pregnancy, what happened, the stress, the fear, the dreams, the desire and aversions. It is not only pertaining to food, but in general, some might have desire to go out. They don't have they are averse to stay within the home, or some have a desire to always husband should be there and take care of her, or various desires, whatever it is. Apart from food, the all the desires and aversions. So when you tell this to them, it becomes more general, and tell them especially the changes that is not regularly present, which was specifically only during pregnancy. That is most essential. Like for example, generally if the mother is having a desire to stay only in house, cook, doesn't mingle with everybody, but during pregnancy, The mother doesn't want to stay in house, always want to go to relatives' house or go for shopping or go for movies or whatever it is. So this is the contrast. So this plays a vital role. And if the same you see in child and if the same is there in pregnancy, then that is a double stamp. So all these things are needed during pregnancy. Then their birth history. If it is like mentally retarded child or autistic child or a child with deeper complications, congenital disease, it is better to get all the detailed history of all these things, birth history. Was there any complication during delivery? Sometimes the child can be kept in incubator and mother feeding will not be done for 1 month, or all these things are there. But if you're seeing the link between these informations and whatever the parents are telling and whatever the child has told, then this becomes a vital point for selecting the remedy. So gather the information and just keep, but don't go, okay, this is the only thing. In pediatric cases, it has to be the trio. All the three things, what is the commonality? And you have to see that commonality, and if you prescribe, for sure, the remedy will never fail. So any complications during delivery? Was it full term? What was the birth weight? And certain inquiries like was there jaundice, breathing difficulties, or any feeding difficulties, all these things. So history after birth. Was there any problem? Ask sometimes first general question. If general question is not answered, then you can go to particular question in details. Immediately don't jump into particular question. So ask general question. Was there any problems in the mother or child after birth? So if it was there, they will tell by themselves. So how soon the mother and child was brought together after delivery, and how is the feeding, how often the child feeds. So this indicates the appetite of the child. How does the child suck the breast, whether it is fast or slow? Because in a child that is less than 1 year, so you can't because still movement has not developed. So you don't know whether the child is a fast pace or slow pace. So all these things helps us. Any preference for the side of breast? So if bottle fed, so ask what milk they are giving, especially if they bring the child for digestive complaints. Sometimes the change in lifestyle habitat also helps to just recover from the complaints. It is not always medicine has to be given. So ask them for digestion if they bring the child that the child is passing diarrhea or there is constipation or there is frequent erections, regurgitation, or vomiting. Immediately the child vomits after drinking milk. So ask them what milk you are giving, how frequently you are giving, are you sleeping and feeding the child. So all these things help to just guide them in proper direction so that the disease goes. It is not exactly the disease. So when the weaning started, if the child asks for extra feeds and not contented with the quantity of mother's milk, can be considered as thirsty and other as thirstless. So the till 6 months mostly children are not given water. It's only always about mother's milk. So how frequently it is given. So whenever the child feels thirst, they drink. When the appetite is more also, they drink. So all these things helps. Developmental history, like how is the milestones and whether the child is too much matured. It is fast. Everything is fast. Precocity. How is the intellect, the verbal, logical, all these things. All these help in autistic child and MR child, ADHD child. So we will be able to know what is the commonality of the disease and what is peculiar to that child, so that remedy can be selected based on peculiarity, not on the commonality of the disease, common symptoms of the disease. And it also helps us to tell the parents for the queries which they ask at the end of consultancy. And is there any immunization history? We are having rubrics like ailments from vaccination, remedies are there for that. So you have to always find what is the causative factor for the disease. So family history, how old are the parents? Is the parents, this all helps us in congenital disease. So how old are the parents? Is it consanguineous marriage? How many children are there? Are the children, every children getting the same problem? Like last week also, they one of the parents brought their son who is 11 years old with heart problem. Okay, so her sister, that boy's sister, also had heart problem, and she died at the age of 8 years. So some history, some disease runs in family. So we have to see what is that running in the family. So there'll be a link between everything, all these repeated symptoms, whatever the parent tells, whatever the child tells, there'll be always a link. We will try to understand that link through the cases in the later part of the lecture. But now these are the things which we have to gather the information. Any stillbirth or miscarriages or the childhood deaths in the family, any illness in siblings, parents, or any near relatives, and their social history, like living conditions, where they are, whether they are in a damp house. Okay, so one of the boy, he was suffering from renal failure, and the remedy was acting very well for him, and all of a sudden it did not act. So when asked, they told they have changed the house. So this house is more of dampness, and from above the water is leaking in the walls. So all these things will help us. Their socio-economic status, the mother's occupation, if the mother is leaving the child and going to office, and if the child has to take care of himself or herself for the whole day. So all this helps us. Child so helps us to differentiate the common symptoms and uncommon symptoms. For all that, this is needed. Child as a person, what is their physical and mental characteristics? And the physical constitution, the distribution of fat, emaciated. Some parents bring their child that howsoever the child eats, it is lean. So this is also an issue. Their eating habits, all this has to be inquired. And now in recent days, children are too much addictive with all these fast food items. So this has to be inquired, what they eat. And parents' basic complaint is my child doesn't eat. So then we have to ask what they eat. So when they eat all these outside foods, lays, kurkure or biscuits, then the stomach appetite gets full. Then how they will eat? So by knowing all these things, you can give proper advice to the child and to the parents. So they are generals, like checking the abdomen, neck, to know the thermal state, the perspiration, usage of covering during sleep, appetite, thirst, desire, aversions, and the sleeping position, and the emotional levels, expressions to stimulate. So if all this doesn't come voluntarily, then you can ask specifically through leading questions or direct questions. But if it comes voluntarily, then don't ask it again. So their anger response, how does the child react in anger, whether they are impulsive or silent? Whenever the child becomes jealousy, Like when the child is compared with other children or with the siblings, how do they react? They show their anger or vengeance or whatever it is, direct or it is indirect. So their grief, whether they are expressive, whether they weep, whether they show out their emotions or not, their fears, dreams, hobbies, their sociability, how they are speaking with outsiders, strangers, whether they are easily approachable or they withdraw, they are introvert, their adaptability to situations, their activity, which is high or low in general. And now specifically during complaints, how is their activity? So all these will help us to know the change when they are suffering from complaint and when they are in a healthy state. So the threshold of responsiveness to sound, whether they are sensitive to sound, touch, taste, any temperature changes like climatic condition from hot to cold, the climate changes and the child is affected with some physical problems, all those things. Intensity of reaction, the amount of energy a child uses to express the emotions, like high intensity denotes laughing or crying loudly or easily frustrated, screams so loud, all this. How they react. So some children even lies on floor and roll, shaking their hands and legs till they get what they want. So all these things has to be noticed. So are asked to the parents if it doesn't happen during consultancy. So rhythmicity, the regularity of biological functions like proper in what time they sleep, hunger, eliminations. Sometimes even because this rhythmicity is very important. One of the child was brought for constipation. Okay, whenever the child is out of station, the child suffers from constipation. So every day the child passes stool. So the just the giving the advice of whenever you go outside also make the child to sit in the toilet. Okay, now the it is fixed in the brain that this is the toilet in my home and now I have to pass here only. So it did not get accustomed that outside also like it is toilet because there was no other disturbance. Otherwise, the child is in every way healthy, no other things. So just an advice of giving the telling the parent, make the child whenever you are going outside also, even if it is getting, but the child is getting the sense to pass stool or not, just make the child every day to sit in toilet wherever you go. So just by doing this, the child's constipation was relieved. After doing this 3 to 5 times, the constipation was relieved. So sometimes it is just the rhythmicity and sometimes the child passes motion any time in a day. So you have to tell the parent, make the child to sit every day for motion at a particular time in the morning only. So even if it passes or not, then they begin to pass. So all these things, even sleep also. Tell them at a particular time in the night, don't give mobile. And nowadays, this is going crazy that children are always with mobile and when the mobile is taken away from the child, then they become so violent. So make them engage with the talks. Tell the parent to speak with the children during night after dinner, play with them or make them engaged in talk so their child is out of mobile. Keep the screen away from the child 1 hour before the child goes to sleep. So all this helps the child to sleep because the child is brought that it is not sleeping at all. It is always watching mobile till 11 o'clock, 12 o'clock. So these type of advices also helps. So gathering information about the distractibility. So how frequently the child gets distracted while studying or doing some activities. So all this becomes an issue when the parent brings the child for examination fear, etc. Something related to that. So attention, one of the child, he doesn't go for examination because of the fear that he will fail. Okay. So many things. it is a combination of many things which you have to see, whether it is because of the parent, or because of the child, or because of the lifestyle that which they are living, or it is because of the own emotions of the child. So it is, child case is multi-dimensional. So how is their persistence in doing some activity, how long they carry over that activity, or if they read for some time, then they are quickly distracted and do some other activity, whether they are restless, all these things you will come to know by this. So the destructibility, how they are destructive. The destructive may not be seen mentally, like sometimes hitting the other child or like that. Sometimes you can see the destructiveness, even the paper, the child always tears the papers and put, or the child cuts the hair. So many types of destructions you can notice. So finally conclude the interview by local examination, proper general physical examination and local examination. For example, they come from for tonsillitis, then see the tonsils, whether any pus is collected or there is redness, or if they come from stomach pain, then palpate each area of the abdominal region and see which region is tender. Is there any redness in specific area, or is there any swelling? So whatever complaint XY is that, if they are coming, then do that local. If it is for respiratory problem, then auscultate and see which area of lungs is affected, what is the type of sound. So what complaint the child is brought for, do that local examination for sure at the end of the case. So this is all about the case taking. So now we will see some cases. So before going to cases, is there any doubt till here? Is the picture clear? Whatever we have studied today, how to deal with children, what should be the attitude of the physician, how the physician should converse with the parent, how the physician should converse with the child, what all data needs to be collected. Are we clear till here? Please, everybody respond through the chat box. Otherwise, because your screen is also not visible, don't know whether you are listening or doing something else. So our only way of connection is through this chat box. So please respond through the chat box whether it is clear. Only 4 people have responded. What about others? Okay. So now we will see a case. We will see few cases of different age group of child. So we will different types of pathology and the different types of conversation with the child. So we'll be getting how to do it. Is my screen visible? Is the text visible? Okay. So this boy is 4 years old and he had complaints of baldness in the head. So he was brought for consultancy in 2015. Tell me all the problems. When I asked, the mother told. The boy is 4 years old, so the mother was telling the initial history. So mother told that he is having that boils in head, it is itching, watery discharge, comes out from it, and then the hair falls in that area. This is the sequence. First there is boils, then it is itching, water discharge comes out, and then the hair falls. It began when he was 2 years old. Initially, it was a small patch, and gradually the area increased. Took him to 3 skin specialists, but there was no improvement. He had oily brown color discharge from both ears when he was 2 months old. So the mother told the physical complaints and then remained quiet. So I asked the mother, more whatever you want to tell about him, I want to know about him completely, both physically and mentally. So then the mother told he has fear of dark and ghost, always wants light in the room. Immediately after waking up, he shouts till he sees me, wants to be with me always. When asked more, the mother told that's all. Even these things she asked, she told one by one only. It was not like completely everything together. So I was asking more, what else? This type of questions. So then, because alopecia aerata is an autoimmune disease, and he is having this in a such young age. So, as told already, in such cases, it is better to get pregnant history to see what is the commonality that is present in both. So tell me what all difference you had during your pregnancy period, those 10 months, both physically and mentally. So she tells, after 25 days of my conception, my husband went to abroad. I felt lonely and was weeping every day, always worrying that no one was there to take care of me. So can you see the commonality? The child is also wanting the mother. Immediately when he wakes up, the child is also wanting the mother and he shouts. So here in pregnancy also, she is having that loneliness, weeping, and no one is there to take care of her. So the commonality is there. So that is why I went deeper into it to see the experience in that loneliness, physically and mentally. She told that there is tightness in the muscles. Experience in that tightness is extreme tightness, contraction, feel more power and energetic than the usual. So after some time, I feel complete exhaustion, weak, not able to do any work. So experience when you are with husband, the other side, fresh, more experience in it, active, can do many works, no muscle tightness. Active, yes, active than usual, but not like when I am in sad. Then when asked more what other things during that pregnancy, she told she's also having fear of dark and ghost, which she narrated in child also. Will not eat well, and that's all. So changes in the body in that moment of fear is shivering throughout the body. And then dreams, it was asked, because dreams is a subconscious area where we will get the exact state. So dreams during pregnancy, she had the dream of ghost, and the boy is also having fear of ghost and dark. So here she told there is dreams of ghost and thief. 2 person died in my home before few years. I always thought about it only during my pregnancy period with fear of death. So those people who died before few years, she thought about them, constant thought about them only during the pregnancy period, and there was fear of death. So if something happens, the situation, it is impacting her internally and she is experiencing it. So her stressful situation moment where husband is not there, and whenever she is alone, in that stressful moment, her experience is tightness of muscle, contraction of muscle, and after some time it is weakness, exhaustion, can't do any work. And in happiest moment, when husband is there, it is all about active, can do more work and no tightness. And her physical experience during fear is trembling. So then I tried to interact with the child, but he was not talking. But there was a commonality between whatever the mother narrated and the physical symptoms, which is peculiar symptoms like this oozing of discharge, and then there is hair baldness, hair falls out from that area, the physical symptoms, and the commonality between the child and the mother's pregnancy history. So with this, I tried to analyze the case. So all this sensation indicates plant kingdom, and the family is Apocynaceae, where there is on one side contraction of muscles, high activity of muscle fibers, high contractility, even high working capacity, even at brain, followed by atonicity, fatigue, exhausted, no energy, weakness. So exhaustion will be seen both at physical and mental level in this family. Why is it so? Because the alkaloid of this family stimulates acetylcholine. The alkaloid of this family is cholinergic stimulators, which stimulates the acetylcholine. And this acetylcholine has functions both in the peripheral nervous system and central nervous system as a neuromodulator, which activates the muscles. In peripheral nervous system, this acetylcholine activates the muscles. Inside the brain, this acetylcholine functions as neuromodulator. So they play an important role in arousal, attention, and motivation. That is why they will be able to do more works during that time. So because of this alkaloid effect of acetylcholine, Apocynaceae family has this sensation of muscle contraction, exhaustion, followed by muscle contraction, high activity, followed by exhaustion and relaxation of the muscle. And the level of experience is emotion, because day-to-day life only the child is living the experience of fear. So the remedy was given was Vinca minor 200 weekly once from Apocynaceae family. So about Vinca minor from Clark, Media Medica. The causation, mental exertion, tremulous and starting. So for them, it is the shivering. She told no that during fear there is shivering, and in mind there is sadness with fear of death, lachrymous. She told during pregnancy that there is fear of death, and she remembered those dead relatives only during pregnancy. And in head, the hairs are entangled, plica polonica, the hairs fall out and is replaced by grey hair. Bald spots covered with short woolly hair. So the same in Boric Mitra Medica also. So these are the rubrics that are taken. Mind, anxiety, fear, mind, despair, mind, loneliness, death, thoughts of sadness with, fear, sadness with, fear, death of sadness with, frightened easily, weeping, tearful mood. So on repertorizing all these rubrics, Vinca minor comes in third place. Platina comes in first place, Cuprum in second place, Vinca minor in third place. So now by taking the case deeper and knowing what is the sensation and function of that person, what it helps us to select the remedy which is even in third place or fifth place or eighth place also. We don't go just with marks. We know that Platina and Cuprum are from mineral kingdom, but she is from plant kingdom. Okay, plant kingdom, and her sensation is of Apocynaceae family. And now which remedy in that? So with rubrics, we are getting Vinca minor, which is in third place, which is from same family. And these rubrics were taken for physical symptoms: head eruptions, moist spots, head falling out hair alopecia, head falling out hair alopecia spotting, head itching, scratching must, head itching, scalp external. So by repertorizing, here Vinca minor comes in first place. So this was before treatment, the left side. And the right side is just after 15 days of treatment. You can see some hairs are grown. And just see, just Vincamena 200 was given weekly once. That means only 2 doses in these 15 days. But see the improvement. Whereas he was suffering from this complaint for 2 years, and from the age of 2 years, and they have visited three skin specialists also for this. So after 45 days, then this is after 3 months. So cure not only happened at local level. When asked to the mother, what are the changes that is there after this 3.5 months of treatment? So she told there is no stomach pain, which she didn't even tell during consultancy time, because that time for her the botheration was about the alopecia, and she brought the child only for alopecia. But now she is telling, now he is not complaining of stomach pain, he is sleeping well, not irritable, always calm and quiet. I'm 100% satisfied with this treatment. And so the medicine was stopped, and now it's been 8 years. Till now, he did not get that complaint again. Let us listen to the mother. You can read the subtitle. So this is the change. You can see the happiness in mother's face, even though you are not able to understand the language. So she is completely satisfied with the treatment, and just he took treatment for 3.5 months, and because he is completely fine, I have stopped the treatment. So now we will see another case with a different problem and different age group. So this child is 5 months old, and the child is brought for the complaints of cold, and the cold was increasing, cold, then cough, then breathing difficulty, vomiting. So the mother is having a wheezing problem. So she was afraid whether the child will also suffer from wheezing problem. So they brought the child at the age of 5 months. And mother is also my patient. They came basically for treatment of infertility. Like after 12 or 15 years, I don't know exactly, but it was a longer period that they were not conceived, and they tried various things. And the best part is treatment was given for the father and mother both. They are individualistic remedy, and they conceived after 1 year or something, like 1.5 years of treatment. And at the age of 35, mother's age is 35, and she conceived, and it was normal delivery. And they are like so much more towards traditional things. So they even did normal delivery at home. I was so much surprised for their this attitude when they came and told. I was so much surprised. that kind of, I did not believe on my medicine, but they are telling we were so much confident about your medicine and the treatment, and so we did not require to go to hospital. So I was thinking, but you have taken risk because of so many years of infertility, and at the age of 35 years, this is a little risk, but good that nothing happened. So at the age of 5 months, when the child was suffering from cold, they brought the child. 5 months old baby came for treatment of cold on 26th July 2023. So mother was narrating and father was sitting nearby with the baby in the consultancy room. So mother told, I'm having cold, I'm feeding baby. Now she is also having cold, rattling sound in chest. She is unable to sleep at night, cough with vomiting. After feeding, there is continuous vomiting. She is having cough like me. I'm afraid whether she too will get wheezing like me. Even by touching the chest region, able to palpate the rattling of cold. Since when this complaint is there? Since 2 weeks. Because now we need to know what could be the causative factor for a 5 months old baby to suffer from cold. And that too you can see the severity of the cold. Just the palpation with hand also, not even with stethoscope. So much there is phlegm accumulation in the lung. So I asked, since when this complaint is there? Since 2 weeks. When it's more, always in daytime also it is there. I began to go to office from 1st July onwards, like that mother told. So did it start after that? Yes, it started after that only. Initially it was mild, but with the days it increased. So that could be the reason also, but we don't know. Better to wait and watch. Like separation from the mother. But we don't know at this point of moment. Always Shekhar sir tells, possess everything in the case, but don't be possessive of something that is single. If you become possessive of something single, then what happens? Our focus will be only towards that and we will forget rest everything in the case. And then we will direct the case towards that remedy. And it is not the patient is directing ours towards the remedy. Doctor takes the case as per the prejudice of, okay, now this is the remedy, ailments from separation of mother, what all remedy is coming in that, and ask leading question to that. Okay, do you desire salt? Then give natramune. So it's not like that. Now we have to take the case, but don't be possessive of anything. Then father was telling, now my wife is staying at her mother's place. Their house is open area, so it might cause cold. We are doubtful whether that is the cause. So this also could be the cause because the child is brought now to different house, which is open area and so much of air is there. Okay. Then I asked the question, what are the changes in baby since the beginning of this complaint? So sleeping time reduced, skin eruptions in forehead, to see what is the complaints that are associated with this cold one, and to see what is the generals that has changed previously from previous to now. So instead of asking one question, how is the thirst, how is the sleep, how is the motion, so many questions, instead of asking single question, just one open-ended question. What are the changes in baby since the beginning of this complaint? One question will allow the parent to tell all the changes, which will be more of unprejudiced also. So sleeping time reduced, skin eruption in forehead. She is itching. Her activity reduced. Now she is adamant. Previously she will remain silent and adjustable. So I told, give an example for it, because we can't take as such whatever the parent tells. Now this is true. So because they told previously she'll be silent and adjustable, now she is adamant. So I told, give an example. Then they told, now during the consultancy, she told, this belt has to be removed from dress. It has to be done. Otherwise, she will shout and throw things. Previously, she will be silent. Previously, she will try to speak. Now, not trying to talk at all. Now, she is not willing to play in water. Previously, she likes to play. Okay. So, they told all these things. In front of me only, she told like this, remove the belt like that. Then they removed. So, what I told, you put the belt. We will see whether what they are telling is true. So, after again putting the belt, what happened? She began to cry loud. So only when that belt was removed, she was quiet. And previously, she will not be like that. Even if they are not doing what she is telling, she used to remain quiet. She will not be like this cranky, shout and throw things, all these things. So any change in drinking water, they told we didn't notice it. Then mother told, I think she is missing me so much. So again, I asked, when did this complaint start for her? First week of July. When did you go to office? 1st July. What will she do when you start to office? Some days cry and some days remain silent. But while returning from office, should carry her at once. If not, she will shout and cry. Any other changes in her after the complaints? Appetite is normal. She eats everything. Always she feeds one mouth to us and then she will eat. Always she will feed at the age of 5 months. See what she is doing. She is feeding to their parents and then she will eat. Will she eat by herself? Yes. What else? Vomit is there after the cough. What is the consistency of vomit? Like curd. After eating, if she coughs, then she vomits. Is the is it dry cough or phlegm comes? Mild phlegm comes, it's not dry. What she likes to eat to the most? Green leafy vegetable, dal and ghee. Aversion, spicy food. What other changes? Now she is rotating 360-degree during sleep. Previously, if she wakes up during sleep, she will remain silently sitting. Now she is weeping. Then I was simply talking and playing with the child with a balloon. Then what other changes? Nothing else. So then I asked, was there any stress for you during July month? So I have put an open-ended question. We will see whether that suppression, even if it is haunting our mind that, okay, this suppression might have caused this problem, better to ask open-ended question and see what is there in our mind is true or not. So she told there was financial problem at home and so I have to go to work. And then that time father interrupts and tells, every day she will be telling to the baby, it's more only 14 days. Then she will tell it's more only 13 days, 12 days, 10 days, like that. But these are the words every day. After that, we both will be separate. I will come to home only in evening. You have to be alone. This is what she was doing. So I asked the mother, did you tell like that? She told yes. So what affected you to the most? For the sake of money, I'm leaving my child and going. It was like, what for you? She is our life and I am leaving her and going. These many days we were without baby, but now I am leaving her. What happened to you while leaving? Palpitation. What else happened? Like if a road accident happens, shock. Like that it was. What happens in that shock? Shivering of hands and legs. More. Then, like child, again she was starting some story. I told, no, forget everything, just this shock. Tell what happens. There is heaviness, chest is heavy. Describe heavy. Again she was narrating, when I left her, then I stopped her from talking because now we are getting sensation. So we have to go deeper. So When I left her, no, just describe heavy, like weight kept on chest. Describe heavy weight in general. During that time, head pain increase. No, just heavy weight describe in general. When someone separates, again and again, she was going into situations. So I was making her to stay in that heavy and weight. When someone separates, no, just leave the situation, tell about heavy and weight in general. During that time, there is difficulty in breathing. Head pain like heavy stone kept on head. So that is also about heavy stone kept on head. And there is difficulty in breathing. As she was not going further, again I came back to that shock incident, because from there only she went into this sensation of heavy weight, difficulty in breathing. So then again I asked, in that situation of accident, you told accident, there is shock. What affects in that accident that causes shock? So now what happened? I have did a mistake here. I have dragged the patient to sensation without knowing the background picture of how that sensation is happening. So this background picture is needed for knowing whether the medicine is from plant kingdom, animal kingdom, or mineral kingdom. So the background picture is, in order to know that background picture, I asked what in that accident is causing shock. So she told there is got hit and bled. I will start to think, if the same happens to me, how will it be? How will it be? Painful and suffering. Nobody is there nearby to take care. Meaning, if someone is there nearby, they will take care. It's a support. In what way? Just holding the hand and telling, I am there. By that, pain will reduce. They will get confidence and courage that a person is there to take care. Experience from head to foot during that time, everything will be fine. If no one is there, what happens? Heart pains, that no one is there. Heart will be heavy. Now again the same sensation she describes. But what missed during case taking previously was the background of that sensation. Now we are clearly knowing the background of that sensation is that somebody holding the hands and giving that support, I am there. So, and by that, she gets that confidence and courage that a person is there to take care. So this indicates mineral kingdom. Because of shock and now the sensation of heavy and weight, we doesn't directly jump to plant kingdom, because mineral kingdom needs this support. And by that support, they get that confidence and courage. This is the background of mineral kingdom where this sensation develops. Just describe this heavy with an example. Weight, tight, difficulty in breathing. What will you do during that time? Can't do anything. So with weight tight, there is always this difficulty in breathing. What will you do during that time? Can't do anything. Should share with husband. Then I become relaxed. So what she does during that time? Sharing with husband. So that is also mineral kingdom. Sharing. By sharing, their sensations are relieved and they get that confidence and courage that the other person is there. If he is not there, I will call him and inform him. Through phone call, she informs. What happens by that? I get confidence that he is there to take care. Okay. So this is her narration and the symptoms which we gathered from parents about the child, and observation about the child was silently playing in the consultancy room, either sitting on mother or then on the father, or then she'll be playing down with balloon. There was no sound at all in any way. It was like total silence. When this case went for 45 to 50 minutes, till then the baby was silent. He did not tell now we have to go out of consultancy room, or he did not ask for water or milk, food to drink, nothing of any sort, or nothing of any sort of disturbance. It was totally silent. Only time it became that cranky was when she told the belt has to be removed and again the belt was put, she began to cry. Only during that time, the baby was crying. See, this remedy was given for the baby, only one dose. And because the mother is feeding, the remedy was given for mother also because it is her emotions which has affected the baby. She was telling every day to the baby, I'm going to leave you, I'm going to leave you. And there is symptoms, mental change also in a baby. Like previously she used to talk, but now the baby is not talking. Previously she used to adapt to situations. If something is not given, she remains quiet. But now it becomes opposite. She becomes, shouts and cries and throws things. So previously, if something is there in her hand, if they ask also, the baby remains silent. But now the baby is not giving that. So there is some repulsion also. And the baby became more introvert. But anger is shown through throwing things. It is not adjustable. The baby is not adjustable now. So there is a difference in the mind also in the baby. It's not only physical change, like because of cold, the appetite reduced, the thirst increased, all etc. etc. It is not only the physical change, but mind also has changed. So I gave the same remedy, one dose for baby and 3 doses for mother, followed by placebo for 1 month. Okay. So then she was completely fine. So next month they called whether we should continue the medicine. I told no, if any problem, then you can take medicine. So yesterday, for the sake of presentation, I called and asked how is the baby now. She told after that no complaints at all. She did not get cold, and that is why we did not come. And now the baby is 2 years old. They came in 5 months. And this is the video feedback by the parents. So yesterday I told them to send video, and she waited for the whole day for the husband to come, and they will give the feedback together. See the amount of clinging that is there in mother with the husband, which he narrated in case also. That husband is needed for sharing that I'm there. So that is there here also, now also. So the remedy given for the baby and mother was natrum carb because of that clinging to that one person who is a support, who is there to tell, I am there with you. So the person gains confidence, and the physical experience of carbon, that heaviness, difficulty in breathing, trembling of hands, all these will be there in carbon. And if you have to see the natrum carb respiratory problems in whatever Metra Medica, you will see all these rattling sound, cough with phlegm. It is not dry cough. And in temper tantrums, also you will see natrum carb, natrum mure, which the baby was trying to show in anger, throws things. Previously, the baby was so much silent, and the separation of the mother has caused the problem. So, based on this, all the physical, emotional, and sensation, the experience of the mother, the sensation, on based on all these three categories, the natrum carb was given 200 single dose for the child and 3 doses for the mother. And you can see now after that, now it's been 1.5 years, but no problem at all so far. So this is now different age group, how you have to gather symptoms from parents about the child, because 5 months old child will not talk. So you have to speak only with parents and try to find the cause. Main thing is during case taking, you have to find out the cause of the disease. When you target that, the remedy will never fail, be it physical cause or be it mental cause. Always the effect of the disease is known through symptoms, but cause is hidden deep within. We have to find that cause through case taking. Now we will see another case which is of different type. This girl suffered from acne since her sixth standard, and she came for treatment when she was studying college second year. Okay, so how many years of suffering? It's like 8 years. I'll show just the picture of her acne, how much it's rough. See how big acne she has, which was painful, and she was suffering from all these complaints since the age of sixth standard. Okay, but see, just 6 months of homeopathic remedy has caused a miracles in her face. So now, if the complaint is of such long duration, chronicity, for sure there should be some causative factor which has impacted her deep enough, and the vital force is stuck from then onwards, and it is not able to heal itself, and that is why it is there. And with so many years of sufferings, they have tried many home remedies, they have tried allopathy, and nothing has helped her. So now, through case taking, we have to find what is the causative factor for this problem. So when she came for treatment, she was 18 years old and she had acne. Tell me all your problems. In the last 3 days, pimples increased, cheeks are swollen. After face wash, there is pus like discharge from pimple. It's offensive. White layer around the pimple. It's burning. Severe pain. Unable to talk. No sleep. These pimples are present in the past 8 years since my 6th standard, even before menarche. After allopathic treatment, face became black. Face is oily. That's all. What is bothering to the most? Burning and pain in the pimple. After washing the face, a gel-like substance comes from the pimple. It's offensive, sticky, burning and itching. Like chili powder applied to wound. After face wash, this burning is present for 2 to 3 minutes. Okay. Then she was telling how is it during that time, weeping. Tell about that state. She was not able to tell. So I directly went into the stressful moment in her life. She told betrayal by a friend. She made me to trust her, and then she betrayed. It was her mistake, but she blamed on me and she got escaped. Hence, in the last 8 years, I am alone without friends. So, see, just the betrayal by the person whom she trusted made her to go lonely without friends. When did this happen? When I was studying 6th standard. Note, acne also started in 6th standard, which she mentioned by herself in the beginning of the case. After that incident, no belief on friends, and I remained alone, ate alone at school, roam alone, will not mingle with anyone. Tell more about that incident. Friend told that I am bringing money from home and buying snacks for her. So what happened? Parents also lost trust on me. Parents stopped interacting with me. Recently, my mother is interacting with me. My father is telling, howsoever we scold you or beat you, we love you, but I am unable to accept it. Meaning, it's been fixed in my mind that father don't like me. Tell more about that. I desire to be alone always. Even if my mother says that she will sleep with me, I tell don't want. Recently got few friends whom I can trust. Now I like to be alone also and with friends also. Recently she got some friends. So she is having both this to be alone and with friends. Maximum desire to be alone. And she likes to hear motivational and romantic songs. So these songs motivate her. And when she weeps, she hears sad songs. So in the entire situation, what affected you to the most? When friends told so and parents didn't believe, how was it during that time? I should go to a place where nobody is there. Then I feel relief. Tell about that place. I get confidence and whatever happens, I can face. Nobody will betray me and I need not betray anyone. Feel that everything around me is mine. Meaning, nobody will scold, nobody will hate me. I like, if I like a thing, I can do it. I have belief that things too like me. If I interact with a doll telling, I like you very much, same vibrations will return back. So what will that doll do? So this is now projection case taking. What will that doll do? As the patient projected her state with an image of doll, conversation continued with the same image in order to connect the level of the patient so that she goes deeper into that state. If I'm sad and convey everything to that doll, will get a feel that the doll is telling to me, don't do like this. This is wrong. Others will be hurt. Get a feel that doll is speaking to me. What will that doll speak? Example, if my father scold or beat me, I will weep and tell to that doll. And that doll will reply to me, why did father scold you? It's because you did the mistake like this. The doll will convince me. So she began to personify that doll as a person because of the betrayal which she received. And now this doll can't hurt back, right? So this doll, what it is doing, it is helping her out. Father scold for your good only, no, like that. How will it be during that time? Relax and sleep. Tell more about this. Feel confident, safe, and free that I am have everything and I need not feel about anything. Experience in that courage, no fear that I am not having anything. Feel that I have everything. I am safe. So with that doll, what she is getting is that confidence and courage. So this indicates mineral kingdom. So for her, that doll is a support. So experience in the safe, water is there, food is there. We get feel that everything is around me. Experience in that, don't know to tell. If all these are not there, fearful, nothing is there. What will I do? Meaning, if nothing is there for her, it is, shall I go to my parents? They will be around me during fear. I get this feel. Meaning, when I'm not having anything, I go to parents. They will give me everything. They will give me food, water, place to live. What else they will give? Safety. If some problem comes to me, it won't come to me directly. It has to cross my parents and come. They know about it. Safe. Experience in that problem is solved and feel confident. So on one side, she is lonely also rejecting the parents, and other side, she is needing parents when nothing is there to feel that confidence. So both is there. On one side, not needing parents, and other side, needing parents also. That is what was noted, but I continued with the conversation. If they are not there, what will happen? No food, no love, nobody to talk, nothing is there. How will it be during that time? Feel lonely. Don't like to talk with anyone. See, she wants to be lonely also, and if they are not there, she is feeling that lonely also. So there is contrast. Experience during that moment, I am for me. Nobody is there for me. Feel lonely. So I asked her the direct question itself. So what do you want? You want to be alone or not? because she was selling in both ways. Then she told, want to be alone for what? Can take decision that is correct, get that willpower. I can be alone for maximum time without fear. Okay. From 6th to 10th standard, why didn't you form friends? Because I believe my friends loved them, cared them, trusted them, but they cheated me. So I decided to be alone. But 11th standard friends, they came and spoke with me again and again cared for me, gave me belief. Meaning, whatever they tell is correct. I will not cross check whether it is right or wrong. I had that much belief on them, but they betrayed me. So I changed my classroom in 6th standard. So for her, friends is like total, she will not even cross check whether it is right or wrong. It is total belief. They love, it is a love, a care, a trust. But there is a betrayal from the same friend whom she expected all these things. So what type of belief it is? Whatever they tell, I will do because they are my friends. It is a blind belief. What is blind belief? Believing without doubt. They are correct. Can trust them. No mistake on them. They will think and do what is right and what is wrong. Experience in being with them. Courage, confident, trustable person. Complete belief. I can believe them and go anywhere, do anything. So this is column one type of remedies in mineral kingdom. Natrum, lithium, kali, they all have that total belief, total clinging. Now we saw the previous case also. For even giving yesterday follow-up, she wants her husband to come home and they want to give follow-up together. So this is the clinging. The natrum always wants a person. For what? For that love, care, affection, for that trust. And natrum can't make that decision. Whatever the other person tells, they believe it blindly and they go with them. They don't check whether it is right or wrong. It is total surrender. So by that, what happens is they get that courage and confidence that this is a trustable person. Believe them and go there. Do anything. They tell everything for my good. That belief. So experience in that belief they will not cheat. Experience in that belief, like parents, they will take care of us. Can do anything. That's all. So dreams is like a Barbie, Cinderella. What they are imaginary things, and they are spending time with me. So, during that time, it is just jolly and comfortable climate. Winter, summer, there is more sweat, desire for chocolate, and aversion to fish. So analysis of the case. So these rubrics were taken. Company, aversion to solitude, desire for. She always wants to be alone, not even want mother to sleep with her. That rubric. Company, aversion to solitude, desire for weeping. Company, desire for alone, aggravation being. This also is there. She wants a person also. That's why I asked her both ways. Do you want or do you don't want? So alone also aggravates them and they desire for to be in solitude. This contradiction will be there. We will see why that contradiction is there in this remedy. So then there is company aversion to desire for solitude, deception, disappointment, deception, ailments from love, disappointment, unhappy, ailments from aggravation. We see natramure also, ignitia also. See, both are complementary remedies. Best complementary remedy in homeopathy, which we all know. But natramure, now this kingdom differentiation helps us. Natramure is mineral, ignitia is plant. Ignitia is from Loganaceae family. Before 2-3 days, you would have listened to lecture by Dr. Banu Chandar. What is the sensation of Loganaceae family? But that sensation is not there in this case. It was not just because natramure came in first rank, the remedy was given. But her experience is getting confidence and courage when that person is there. So the other rubrics for the case is aversion fish, which is there in natramure in Alan repertory. Desire chocolate is there in Murphy Medramerica. So we know the face symptoms of natramure, which all covered her physical complaints. So reference from the book from Rajan Shankaran sir's Substance of Homeopathy. The main feeling in natrum uriaticum is betrayed, disappointed by the person whom he or she seeks that relationship. So she seeks that relationship, that love, care and affection from that friend, complete blind trust. But that friend betrayed and that made her to not make friendship for 6 years. And in 11th, she got some trustable friends, and that's how she made relationship with them. So there is desire for music, romantic and sad music. She told no, she likes romantic music, and whenever she weeps, she likes to hear sad music. So they have this fear of being alone, disappointed, and hence are reserved and unapproachable. Fear of being hurt, and that's why they are disappointed. At the same time, there is tremendous insecurity with fear of being alone. So you can see both contradiction. They want to be reserved also because of the fear of hurt, but at the same time, they have the fear of being loneliness. So they have that silent grief, weeping when alone, aversion to company, shut off from people. This again alternates with the desire for company. Okay, your this my PPT was not visible. Just now I have noticed it. Hope it is visible now. Is the PPT visible now? Okay. So this contradictory symptom is there in natrum muriaticum. They are independent also, dependent also. Why is this? Because natrum having 11 electrons and it has only one electron in the outer ring. So it needs 7 more electrons to get that stability. So they are always clinging in relationship, which is represented through rubrics like company desire for alone aggravation. Whereas chlorine, which is muriaticum, the other part, have 7 electrons in the outer ring, which needs only one more electron for its stability. And this represents the independent nature. This lacking of one electron doesn't make much unstable for chlorine. So they don't want relationship. They are anti-relationship. They can stay independent. So that's why from chlorine, these rubrics arises. Company aversion to desire solitude for all these things. Company aversion to desire for solitude. Company aversion to presence of people intolerable to her. So this contradictory symptom of natrum muriaticum is because of one side of natrum which is needing relationship and other side of chlorine which don't want relationship. So her follow-up, this was her follow-up after 6 months and she was completely normal. And so I have stopped the treatment. And now it's been 3 years after stopping the treatment. So I told her to, I always speak with patients who stop the treatment, how they are, whether there is any recurrence. Because Shekhar sir has taught us, it's not only during treatment, but after treatment also you have to check whether the remedy has done the needful. So this is her follow-up. Yesterday she has sent her video. You can see that pimples did not recur till now. Is the screen visible? Okay.
Hello everyone, I'm Divya from Tamil Nadu. I used to take this homeopathy treatment in the period of 2020. I had a problem of high pigmentation and
Is the voice also audible?
Yes, ma'am.
Okay.
black dot all around my face. I had this problem in the standard of 6 where I'm not aware to cure this problem and I I don't know how to stop the pimples in my face. My pimple size will be like a peanuts, which is huge and which is more itching. I don't have the confidence to face the society with that face, and personally myself I pulled backwards in participating and mingling with peoples or some other occasions. Due to this problem particularly I missed some other occasions, and I don't involve myself in any other festivals or visiting the relatives home. This particular issue had made me to do overthinking, like I received some other itchiness or have a peaceful face wash method. I don't have any other sources to cure that problem. In that peak situation, in that peak problem, Dr. Divya had helped me and recovered me within 6 months. I took this homeopathy procedure for 6 months, and it really gave me a good result in that. And now after 3 years, too, it's giving a good result. Until now I don't receive any other pimple in my face. Dr. Divya had provided a homeopathy treatment.
So there is no recurrence till now. So this is what we can see, the recovery with homeopathic remedies. There are many cases, deeper pathological or functional diseases. So recurrence doesn't occur when you take the case in a deeper way, analyze the case, which includes all the features. So it helps a lot. You can see all the cases, how it is becoming permanent cure. So as told by Dr. Hanuman in aphorism 2, single, simple, minimum dose and permanent recovery. So it's my heart full of thanks to Dr. Shekhar Algundgi sir, who taught us homeopathy, metra medica, case taking, the principles of homeopathy, the follow-ups, how it has to be done, how the clinic has to be set up, everything. He has taught us from A to Z. So we are able to enjoy the results in everyday practice. This is possible by everyone. What you have to learn is you have to learn dedicatedly with proper guidance from a doctor. And so it's not like everybody can go and sit with a doctor in a clinic and learn. Only some people get that opportunity to sit with senior doctors and learn, because these things are not taught to us in college. We just study in college for theory, for marks, important questions we study, important points we study, and just write the answers. Fill the papers in order. We don't know why these things are there. We don't know the practical application of Kent's observation, Herring's law of cure, the aphorisms, various case-taking aphorisms. Practically, we don't know. But when we go and sit with a senior practitioner in their clinic, we see the in and out, how they are handling the case, different types of cases, pediatric cases, geriatric cases. Every case is an individual, right? No two pulsatilla cases will be same. The case taking will be different. So, friends, those who can't have that opportunity of going and practicing in senior doctor's clinic, Gurukul is the best place for them to learn. I was not able to go to a senior doctor after my BHMS because I got married immediately. So Gurukul helped me a lot. Whatever I'm today is all because of dedicatedly attending Gurukul in the beginning of my career. So my thanks to Shekhar sir for whatever I am today in my career is all because of him. Thanks to the management, to the principal for giving this opportunity to share our practical experiences with all of you. Thanks for joining in. So with this thought, we will end today's session. Please attend Gurukul at least once in your lifetime. You will never ever regret for it. 7 days might be a longer period. You have to face various obstacles, but just cross that obstacle single-mindedly and attend Gurukul and see. That will be a direction of change for your life. Thank you.
Thank you very much, ma'am.